Hi, welcome to my presentation. I chose to do mine on how to die in Oregon. It was directed by Peter D. Richardson and released in 2011. It details the account of several patients in Oregon who have chosen to utilize the death with dignity law. It's a documentary that provides a first-hand account of what it means to use the death with dignity law. It gives viewers a look at the process as well as the advocacy group that provides support to the patients and their families once they make the choice to consider using the law. And it also gives the participants a chance to voice their views and wishes on the decision that they've made. So you get a first-hand look at what they're dealing with, how they're suffering, and what the process looks like when you make the decision to use the death with dignity law. So how does this work? For the protection of both the patient and the provider, a set of rules have been established. Key points include that the patient must be able to provide an informed consent for this process, and it is required that 2 physicians sign off. So you have to go to one physician who is agreeable, and then they have to refer you to a second physician, and only once you've obtained the referral or prescription from the 2 physicians are you able to then pick up the medication. And it should be noted that nurse practitioners and physician's assistants are not allowed to participate in this law. And physicians must be agreeable to participate as well. It's not something that's being forced upon physicians in Oregon. So the person must be of sound mind up all the way up to when they do choose to take the medication, because they administer the medication on their own. This is not a scenario where the physician mixes up a cocktail or injects a lethal dose of a medication for the patient. They simply provide the prescription for the patient to do so on their own. You also must have established residency in the state of Oregon. You may have heard stories of people moving to Oregon from other places so that they can utilize the death with dignity law, but you have to live there steadily for at least 6 months and have established residency before you actually qualify to utilize this. You also have to have been diagnosed with a terminal condition. So you can't just decide that you don't feel like living. You actually have to be diagnosed with an irreversible terminal condition. There are several different kinds of medications and cocktails, if you will, that have been created since the birth of this act. One in particular known as Seconal, Seconol, Seconal, is utilized pretty frequently. The cost of these medications did skyrocket into the tens of thousands of dollars for patients wishing to utilize this, and it's made access very difficult. So over the past few years, since this actually also is legal in Washington, there were some physicians in Washington who have created other blends of certain medications that are more affordable. Some of the medications that you might notice being mixed would be things like digoxin, phenobarbital. There are some that include morphine and various other medications. And it is interesting to me that in some cases, your insurance company will cover part of the cost of these medications as well. So this is an ethical dilemma because we are talking about one of the age-old ethical debates of euthanasia, also known as physician-assisted suicide or physician-assisted death. There are many, many more coined phrases for this. But the ethical dilemma is that, there are two kind of different sides to this coin, where there's a group of people that feels that this is in direct violation of the Hippocratic Oath, in particular, the part that states that you shall do no harm to your patient. And some people literally take that as meaning that this is a direct defiance of that, decree. And then there are those who believe that we are causing more harm by allowing people to live extended periods in pain and suffering, so that the Death with Dignity Act would be an acceptable resolution to that situation. The first principle, and in my opinion, I think the most important theme to consider in this case, is the person's autonomy. In many cases, autonomy is the last thing that the person has left when they've lost everything else in their life that makes up their personhood. And, they really have no control over anything else, and we should not take their autonomy away from them. If the person is competent and they're making an informed and educated decision, I think that we should respect that. And I have to say that as a nurse, I have found that advocating for patients can be incredibly difficult, but it really is the right thing to do. Those of us that work in healthcare, nurses especially, are, taught that we're meant to ease the burden of pain and suffering. And so often we just really, truly prolong it for the patient when we have the ability to end it with them. The second principle here that we should consider is the principle of non-malfeasance. And as I said earlier, there's kind of two sides to this coin. One side arguing that literally do no harm means that this is not okay, that we should not allow death with dignity. And then on the other side, that by easing the suffering and pain and providing the person a death with dignity is the right thing to do. I would also ask that you consider the video that we watched from week 2 in class. It was called A Death of One's Own, and there are just really a lot of similarities regarding autonomy and the non-malfeasance of these people who were diagnosed with terminal illness and just not able to practice their right to autonomy in being able to end their life with dignity. And it was interesting as well to me because I really felt that the one gentleman in particular who was suffering from the ALS, his wife was his primary caregiver, and she really worked very hard, physically, emotionally, mentally strained to the max to care for him and try to give him the best quality of life that she knew how. And her pain and suffering was palpable just watching that video. And it's really important to remember that the person who's diagnosed with a terminal illness is not the only person suffering or being affected. This is something that the family suffers through with the patient as well. So for those of you who have not seen the How to Die in Oregon documentary, the woman in this photo is Cody Curtis. She was the main person featured in How to Die in Oregon, and she chose to use the Death with Dignity Act to end her pain and suffering. Her decision did not come lightly. She fought a very hard battle to avoid using this alternative. She actually had picked up this medication months earlier and kept it in her bedside stand and really tried to just let nature take its course. However, she started to decline very rapidly and was just suffering very much. She was diagnosed with a very aggressive form of cancer, and there was a grapefruit-sized mass located on her liver. And unfortunately, the only treatment to this day for her form of cancer was surgical intervention that she did undergo. However, they did not get all of the cancer, so it did return, at which point there was no real point in going and putting her through another surgery. She did have post-operative complications, wound up in the ICU, in a coma, and it took her 6 months to learn how to walk again. And she just lived a few good months and then started to fill up with ascites fluid in her belly, and then had to have what we call a paracentesis, where you go and you tap the belly and remove the fluid so it takes the pressure off your diaphragm and you can breathe again. So you can imagine how much discomfort she was in, not able to breathe, just in so much physical pain, and just really declining emotionally throughout this process. And initially, her surgeon was really not sure how she felt about participating in her decision to utilize the Death with Dignity Act, but ultimately she did realize that helping her ease her pain and suffering and allowing her to die with some dignity and grace was actually more of an honor. And she was present with Cody and her family when Cody took the medication. So Cody was surrounded by her family in her home, and she chose to take the medication Seconal, which is, they are capsules, and you pull the capsules apart and you dump the powder from within the capsule into a glass, and you mix it with about 6 ounces of water and you drink it. They recommend over 60 to 90 seconds. You just drink it down really fast. It apparently tastes really bad, and then they recommend that you take a drink of something that you enjoy afterwards. And then within just a couple minutes, the effect does start to take hold and coma ensues and eventually death. But it is very peaceful and it's very painless for the patient. So I would highly recommend this film to anyone, especially going into healthcare, or maybe who's already in healthcare, who's ever cared for patients in these situations. I challenge you to watch this film without crying. I think it's impossible personally, but I really feel like this documentary gives us an opportunity to see these people as people and not as statistics or disease processes. And I think that's very powerful. And we really need to develop a healthcare system that's really patient-centric and helps us to focus on the needs of our patients. And when I really think about, if you want to compare and contrast, on the other hand, in this country, we will take a 95-year-old, frail, fragile person who's very sick, and if they're alert and they request it, we will perform surgery on them. We will stick central catheters in them. We will ventilate them, sedate them. And if they, again, are alert and oriented and request that they be a full code, if the time comes, we will perform life-saving CPR on them. We will break every rib, and to no avail. There's really no great outcomes in performing that kind of CPR on a patient who's, 95 years old and very fragile and frail, but we do it because that's what they want and that's what family wants. And we know 99% of the time that we're not going to be successful, but we do it. So in my mind, I can't understand why when a patient is sick and tired and suffering and there's no chance of them having quality of life and there's no chance that we're going to alter their ultimate outcome, which is suffer until death. I mean, I really think that Death with Dignity offers people in those situations exactly that, the opportunity to die with some dignity and not prolong their pain and their suffering. So that's all I have. References are in the next page. Thank you guys very much for sitting through this, and it's been a great semester with all of you, and have a great night. Thanks. This is the references page. I used the video, of course, also used a couple articles, outside sources, and referenced a death of one's own, which was the video from week 2 of class. So thanks everybody. Have a great night.